Kindly unmute your microphone so that you can be able to speak.
Hi, everyone.
Yes.
Hi, how are you?
Good.
Welcome to the meeting.
Thank you.
Okay. Welcome to the mental health discussion today. Where are you getting us from?
From Nairobi.
Oh, you're from Nairobi. You're welcome.
Thank you.
You're welcome. My name is Ruth Ogando. I'll be the one moderating today's meeting. We are just having like 2 to 3 minutes so that we can wait for other people to join us. You're welcome, Judy. How are you? Judy, are you able to hear me? George?
Yes.
George, can you kindly be able to call on Aflin?
and is also able to work productively in the environment. So say at work, they're able to deliver and do their work productively. At home, they can be able to keep that harmonious sort of thinking and also of working at home. They can relate with others in a good and sociable way. So when these bounds have been reached a certain limit, or someone is unable to cope with the normal school functions, work functions, then we tend to think there could be something more to it. I think most times people think that mental health, just as Ruth has said, when you say mental health, they'll think it's mental illness. They'll start thinking, am I going berserk? Am I crazy? Am I someone who needs to be taken to a facility? Like, those are everything that we think about. But the definition of what health is includes mental health as one of the things that is a component in health itself. Yeah.
Okay, thank you so much, Aflin. And maybe I could ask, how many people, statistics that have shown how many people at least have this kind of disorder, okay, maybe mental health, among, if we take like 10 people, which percentage, which ratio can we say that those people are being affected? And it's not only those who are sick, it's not just when there's lack of sickness. So how many people can we talk about?
Well, the
Back
last
to you, Aflin.
reports that came from WHO had it that 1 in every 5. So you can imagine, say 2 in 10 suffer from a mental illness. And mental illness is broad. There could be psychotic symptoms, psychotic disorders like schizophrenia that most people always dub the sick ones because they're picking papers and they're doing all sorts of things that we term abnormal. We'll call them wendawazimu. I use this a lot because it's common. But there are also people who are just sick and need help. It also ranges to those that have mild symptoms, like just the ones that isolate themselves, the ones that do not want, they feel withdrawn, they have symptoms of fatigue and loss of interest in things that they used to like. They loved listening to music and traveling. They're no longer doing that. They are isolating themselves and they do not want to associate with people. They have changes in appetite, so they're eating too much or they're eating less. They have changes in sleep patterns. They're either sleeping too much or sleeping less. And also others like post-traumatic stress disorders amongst the people, the men in uniform, because of the traumatic events that happen. So it's a broad range, and they say 2 in 10 or 1 in every 5 is already suffering from a mental illness or is predisposed upon their lifetime to suffer from a mental illness. Over to you, Ruth.
Thank you. Thank you so much. Thank you, Aflin. Now, the next question, I want to pose it to all of us, because all of us in one way or another, we've been either affected or infected with COVID-19. So how has it affected you? Is there any changes that you've seen since this COVID-19 started? So it's just, the question is open to anyone. You can just answer. I can say by maybe a raise of hand, then we can choose whoever wants to speak. Either Richard, Judy, Amy, George, and Wanjiku, anybody who can be able to answer this. How has COVID-19 affected you as a person since it started in the month of March? Or maybe during December since it started as a whole? Richard, Amy?
Oh, okay. From my own experience, I am an instructor and I do work with students. So most of the time we used to have the class interactions. So right now we are doing it online like the way we are doing here. And there is a lot that you always have to miss, and when at some point you feel like going to that home of that student so that you can help them to understand. But now, since you cannot reach there, so you are also in one way, or I'm always in one way or affected, because I feel like I should do more than what I'm taking them through because I would be standing alone. Actually, I'm standing alone. In fact, I'm in one of my working rooms. So I'm standing alone here and speaking to myself. But of course, they will be getting from the other side. So it has a lot of effects, whether it is directly or indirectly, whether it is so serious or it is too small, but we have a lot of effects. And because even those students, you understand very well that always they are in class where they can be asking each other, how can I do this one, in case they cannot understand from the instructor. So we have a lot which is happening all of them. Thank you.
Okay, thank you so much, Richard. I could wish to welcome Amy in a special way. Amy was part of the panelist. Amy, kindly, if you can hear me, kindly say hi.
Hello, hi, how are you?
Fine, Amy is joining us from the UK. You're welcome.
Sorry, I joined late. I can say that in my case, actually working in the front line, yeah? And it is so difficult because when you see COVID on the screens, then you see numbers of people dying, you just see the numbers. But as a nurse, I get to see the actual people who are dying. And the kind of restrictions that are there are in such a way that people should not get to them because they're isolated so that they are not able to spread the infection to people. So when you get people dying, then they're dying alone and really afraid, because when you're dying, it's your last moment. It's a scary moment. You'd want people you love to be there to hold your hands, but you find people are alone and they're just dying alone and afraid, and it is really hard. It is hard for the patients, but also like for me, who's caring for them, to see them in that way, it breaks your heart. And so I think that's for me my experience with COVID.
Okay. Thank you so much, Amy. I know it's quite painful seeing all that, but we'll go walking the same journey together. Yes, Admin, kindly.
No, I was just saying, I'm a psychologist. And
please kindly
there's a
introduce
positive.
the name so I don't say Admin.
My name is Munira. There is this
Munira.
positive.
All right, Munira.
There is a positive and there's a negative as well. The negative, I would say, is people's lives are disrupted because of no work and being at home. And sometimes you do get bored and depressed. But if you are active, then you're okay. The positive is, I would say, you've learned new computer skills or other skills as well. And you have more time with your family now to bond and to bond.
Mm-hmm.
So that's the positive, I would say.
Yes. Thank you so much, ma'am. Actually, most of the people were dwelling on the negative, but still there's something positive that we can do about this pandemic that we're in. Any other person who's been affected or infected in one way or another?
No, nobody, I would say.
Oh, okay. Aflin, you want to add something? How COVID-19 has affected you as a person?
Well, yeah, I'll talk from mine, but I'll also add from what others have shared with me. I know there are people who have been stigmatized for having been in quarantine zones. You leave quarantine and you want to go back to your village, and guys are like, no, kindly stay wherever you are because you'll bring the virus to us. So there's so much stigma that people are facing just because they were at the quarantine zones. They did not choose to travel back at such a time, but they're being really stigmatized for it. Then also the lockdown. The lockdown has just made, much as families are coming together, there's also the bit about, even when you mention the curfew, there are people who are having separated families. And now we are seeing many cases of gender-based violence being reported, because now within that small space, you have to share it with someone or your husband who you had been separated with. And now all the memories are coming back, and there's lots of fights and there's lots of battering of women, well, I guess men alike, because there's just gender-based violence that is going on. So there are negatives and there are positives. I believe children are having quality time with their parents, because now the parents can go back home before curfew time, before 7, and now they can see mommy is back, and they're just having a good time with their parents. And I think it's a very positive thing that we can look into. Well, the negative bits, there are those that for someone with OCD who was trying to get away from the habit of constantly washing their hands because they're suffering from obsessive compulsive disorder. Right now, they're seeing everyone else acting like them, and they're wondering, do I go back to washing my hands, or what do I do with my therapist? And they go to the supermarkets and they want to purchase sanitizers, and a hoarder who does not even have OCD has gone and cleared all the shelves. And they're wondering, am I going to die from this? Because they're genuinely very sick, and they also were trying to get rid of the habits. So I think the habits that are coming back are really affecting those that are already into it. Also, for those with substance use disorders like alcohol, the ones that are trying to, the ones that are already in the Alcoholic Anonymous, they're trying to get the bars into the houses back again. They're trying to drink from the houses because now they can't go like freely to the bars. And also because of the curfew time, you can't just be seen drinking at 10 a.m. like you'd be the crazy one. So I think there are positives and negatives that are coming with COVID-19.
Okay. Thank you so much. I think we'll get another more elaborate study program later on where we can discuss some of those challenges like OCD and the stuff. And maybe what about the income generating? How is it affecting? Has anybody who has been affected by income, by salaries, or all of us we're employed such that we get the salary at the end of the month? After that is, or is there anybody who is having maybe personal business? Yes. And so that they can share with us the experience.
Well, I'm just seeing other people joining, but I wanted to talk on behalf of guys from some friends of mine who are mentioning from Gikomba. They're like, business is bad. People are no longer coming to shop there and get their clothes because they fear touching the clothes that someone else has touched. And they're imagining, well, when is this going to end so that I can go back to my business? And there are also those that have lost their jobs. There are those that their salaries have been slashed by half. They're told, please work from home, but we'll give you this amount. But you know, the rent is still the same. It's not like you're going to move out at that time. You still have the same, the rent is the same, but your salary has been halved. So there are like lots of struggles that are going in terms of economic.
Okay. Thank you so much. I understand that. And I want to give an example. My friend called me the previous week, and where he's working, 25% of the salary has been slashed off. And so you can imagine how he's going to try to cope up with the remaining salary. And when they tried to ask about it, they were like, either you accept this salary or you quit. And so you don't understand, if you quit, where you're going. So I understand that with this COVID-19, there's so many challenges that have been brought up, but still there are also positive things that we can look out of it as we try to adjust all of us onto this pandemic. And maybe what are some of the signs that you're looking up to? Like if you can see someone who's been mentally affected, what are some of the signs that you can look up to and confirm, like this person has been affected and we need to look for some help out for them? Amy, I don't know whether you're getting me kindly.
Yeah, I can get you. Sorry. Can you get me?
Yes, go ahead, Amy.
Right now it's really hard to get someone who's to really know someone who's affected unless you've been in constant communication with them because of the isolation rules that are there. So you find that every household is kind of limited to its own cocoon because the social distancing is in place. So then you find that every family is alone. So the best thing we can do right now is just call and talk to people because people are stressed. I think it will be easier for you to spot women who are affected because women tend to be more open to talk about their feelings. On the topic of men, I still don't know how we can reach out to them, but maybe the other men in the or anyone who has more experience on that can elaborate. But what I can say is that we need to just call each other and just text and know how the other person is doing. People who went through stuff, I believe, will be able to talk about what they're going through, if at all you're close.
Tell us what to do and what is it. They have to go there to do it.
Thank you.
Please mute the others. Kindly mute your microphones.
You can't just say, give me the draw.
Okay.
All right. Oh, thank you so much, Amy. Anybody else who can add on the challenge, on the signs that they can look up to, just in case you can realize someone who's been affected? All right. Last week, I think not last week, just on Friday, I was just checking on my Facebook, and I saw a family where the father was asking for some help, and the mother, the wife that is, had died some like 4 or 5 years ago and left him with the 2 children, and he's not able to sustain them. And he was asking for help because he had some suicidal thoughts. And when I was reading through and going through that document, I was like, there's so many people out there who are hurting. And some of the signs that we need to look up to for people who are affected is some suicidal thoughts, because some are not able to take care of themselves. This is the time when someone will opt to do what? To maybe take drugs or even abuse some substances. It's because they want to forget all that is happening. They don't want to come into terms that this COVID is affecting us. And maybe because of the responsibilities that are high, and so they feel they're gonna look for any other way so that they can solve the problem. And that is why I want to argue with my sister's point that let us try to call. If you have any relative, kindly, if you know of a friend, if you know of your neighbor whom you think that somehow is being weighed down by what is happening, just let's reach out to them, talk to them. This is the time we ought to sit and listen to what the other people are going through. I'm going to my third question, and I'm also posing this directly to all of us. I want to welcome Stanley Takuruni and Naomi Kerubo. Thank you so much for joining. What can we do to protect or care for our own who have been affected by COVID-19? We know, I don't know whether there's anybody who has had a direct contact by COVID-19 or personal experience. We can now answer it randomly. Anybody, you can just have your hand up. So that I can see, then I can choose you to go ahead. Aflin, if we can open for us kindly. How do we care for our own who have been affected by COVID-19?
Well, I was seeing a hand.
Okay.
But I was seeing a hand being raised, so I was telling you there was a hand. But I think ways that we need to care for those who've been affected by COVID-19 is a simple rule. It's not been pledged anywhere in lots of books, but it is just very simple. We need to be kind. We need to be kind, because someone right now just needs to know that there are people who are out there for them, and that there is hope beyond all this. Because you can imagine suffering from stigma that your child or your kids have been affected, and then after that point they've all been taken into quarantine. It's too much pressure on them, and they're just trying to get ways that they can cope. So what we need to do is to be out there for them. Let's be kind and let's be supportive in everything that we can. Let's all try to be as supportive as possible, and just know that there are people that they can reach out to, because we will have avoided so many cases of suicide, attempted suicide, and even people feeling like they're not cared for and they just want to end their life because they really didn't see that there was someone out there for them. So let's just have our brothers' backs. Let's have our friends' backs. Let's call as much as we can. I know there's lots of social distancing, but we can reduce this sort of distance by calling, do a mail, just try and do something so that you can get in touch with your friends and in constant communication with your families and friends. Yeah.
Okay. Thank you so much, Flynn. Daniela, are you able to hear me, Daniela? Hello? Ma'am Marina, if you have something to add on that.
Unmute.
Kindly unmute.
Yeah. Yeah, when you talked about how symptoms, I would say there's a lot of anxiety. So there are a lot of symptoms of irritability, anger, frustration, less frustration tolerance, and there's because of all that, there's a lot of child abuse and adult abuse, and all is because of feelings of helplessness, hopelessness, and there's no place to vent out. As you said, they are taking drugs to cope with the situation, but that's not helping. So what we do is, our family, we go into more spiritual kind of mode, and pray, and because it's all anyway Ramadan, time of Ramadan and prayers and all that. So we use the spiritual aspect more to deal with our stresses.
Okay. Thank you so much, ma'am. Let's go spiritual. Yeah, there is power in spiritual when you believe in God. So that we can at least all of us outweigh what is affecting us. Anybody else who can answer on that? Stanley Tarukoni, are you able to get me?
Hello.
Or Rich, if anybody who can be able to answer, it's open. Yes, Richard, kindly just unmute your microphone.
Okay, thank you very much. I think the best way is to try to talk and try also to encourage everybody that it is not only them who are suffering from these problems. So we are all suffering, even those who we are encouraging others, we are also suffering, but we should tell them that we need to be strong. It's not going to be there forever. It's only for a season. And maybe after some few, 2, 3, 4 months, it will have come to an end. Because most people now, I think because they don't see, and that is the greatest fear of a human being, is when they have something called uncertainty. They don't know when it's coming to an end. They don't know what next. You may also get some school-going children asking you a question: are we still going to go to school? And supported by the social media, where you see, I was seeing somewhere they have someone who has a lot of beard, and they say this is when the students will go back to school. This is how they will look like. And you see that is a kind of a scary situation, and it makes them to feel like we cannot see tomorrow. So, and especially those who are on a salary, because that is the greatest enemies, where the livelihood is reduced to somewhere. Maybe somebody was living on a 3-bedroom house, now is reducing to a single or a bed sitter. So it becomes a very great challenge. So I think the best medicine here is to try to talk to them. Try also through this social media, we can also publish some information that it encourages people so that they can understand that it's not only them who are suffering from this problem. Thank you.
All right. Thank you so much, Richard, for that response. I just want to look at one point that has been going on about news. Nowadays, when you look at our news, that is the media, everything is about death, about this COVID, or about the floods. How can we cope out with the media? How can it help us in caring for the people whom we care about? How can we take care of that?
I will say we need to look at the right sources of information. I get this wrong all the time, but I promise to get it right today. There's Kenyans on Twitter. Twitters on Kenya. Kenyans on Twitter, yes, KOT. I think at times getting into social media all the time, it fuels lots of anxiety. Imagine just going to read where someone says someone has been killed somewhere, someone has committed suicide, and the social media is really fueling so much and making people even get more anxious and get more nervous. So I believe that taking a break from it can really make us feel better and then get the information from the right sources. So we can try and get the information as much as we can from authenticated sources like the World Health Organization, the CDC, the Ministry of Health. There's so many the media, so media houses and media that can give us the right information instead of just relying on the other forms of sources like the social media, Twitter, Facebook, Instagram, that fuels just anxiety and gives us lots of nervousness. Yeah.
Okay, thank you so much, Ashley. And another thing we ought to also look at to avoid all this, try to sleep a lot. Try to reduce all the anxiety. As Richard spoke, like this thing is going to happen just for a while, and we have the preparedness in our mind so that we know it's going for a while. You see, when you're prepared psychologically, it's easier for you to get through, to run through it. Exercise, I think that's another positive thing that we also need to take, all of us. Let's try to exercise our bodies so that we can release all the tensions from us and even build our bodies and our health. Eat right, pick on the right food that we ought to eat, and mostly importantly, try to communicate to people as much as possible so that we can all be in the same position. Now, my last question, so that we can wind down for today: how can we comfort those who have been affected? In case you have someone who has succumbed, I don't know whether there's anyone who has had someone who has succumbed to COVID-19, so that they can give us experience. How did they go through that? And in case we don't have that personal experience, then we can share from all that we've learned. So anybody who has had someone, or you know someone who has succumbed due to COVID-19?
Amy has a good
Okay,
thing on this.
Amy, kindly. Now that you work at the hospital.
Yeah, well, the grief from COVID, it's to some extent the same as the other grief, like from losing someone you love. So then these people are going to go through the stages of grief, which there is anger, there is denial, there is all that bargaining, and just trying to come to terms with everything, because this thing is sudden. Last year, December, you had your relative and they were just fine, and now you don't have them because of some disease that still we can't make sense of because of the ongoing research. So what we can do is to just be there for those people, to offer a shoulder where they can cry on, to be able to be there for them unconditionally. And also because of the financial times and constraints, if we can spare just if you can spare 10 bob, 100 bob towards financially helping these people, it would also go a long way. But more than anything, it's just being there for them and knowing that they can always count on you when they need your help. Thank you.
Okay, thank you so much, Amy. Let there be there all the time. I saw another photo that, like, at this time is not the time that you go and sit and start preaching to people about ABCD, but I think it's the time that we need to be there. Just listen to them. But then the pastor is there for, like, I don't care what they're going anytime, and you're not even aware when. So it's very important that we always need to be there for one another. Anybody else who has something to add on how we should comfort those families that have been affected by COVID-19?
I think Amy had a raised hand for some time. I think she may speak. Amy, you are getting us?
I'm sorry, I already spoke. I'm just trying to put it down. Thank you.
Okay. Akinyi, if you can get us on when Mai, or Mamurina, if you can get us, you have an experience. Kindly, Ma'am, unmute your microphone. Unmute your microphone, kindly. Yes.
It's still on a mute.
Marina, can you unmute the microphone so that you
What
can
was the
speak? Yeah,
question?
you can go ahead. In case I just asked her if you have anybody who has been affected
I
by
haven't seen anyone.
COVID-19.
No, I've been at home
Okay, you
3
haven't got
months.
any.
Yeah.
Okay. You're keeping the social distancing and keeping up the station. Thank you so much. But at least try to be with them in case you have someone who has been affected. We're saying that try to be with them, pray with them all the time. Listen to them. If you have any financial help that you can assist them, this is the time that they need them, because most of the people's their monies have been cut or maybe slashed because of the jobs, or maybe they're not able to work. And this is the time that everyone is crying for financial breakthrough. At least we should all be there for them. And how do we treat now in case someone turns positive? I don't know whether you know someone who has turned positive, and how are we able to treat them? Is there a time that
It's okay.
I understand Aflin talked about stigma, that most of us that we don't want to be associated with them, thinking that we can also be affected by the COVID-19. But which is the best way that we can take care of them for someone who's been infected by COVID-19? What is the best way we can treat?
Okay. Okay. So for those who have
I just
been
spoke, yeah.
infected, sorry? Okay.
Yes.
I hope I'm clear.
Yes, yes.
For those who've been infected, I think they are for different cases. So I have been at quarantine sites, and I've also been in at the isolation sites at some point. And I know that there are measures and protocols that the government has given out in terms of how psychological support is meant to be given out, and even how effective you have to be on your personal protective equipment as a mental health practitioner, as a psychologist, just to reach out at that point. But we're trying to limit the interaction, the physical interaction. Of course, we're also taking precautions. So most times we are doing telecounseling. We are having the sessions on phone, so that at least we can have a continuity of care of mental health and psychosocial support services. But also at the same time, we can reach out to those that are in isolation and quarantine sites. For the places where they have been in quarantine zones, still there are measures of the infection and prevention control measures that are being looked into. And also the government, the good thing about the government is it comes up with good protocols that people can use, and even the healthcare professionals can use, so that they can reach out to the people. So I think there's lots of support that is coming in. And because there was confusion at first, there's learning that has also happened, and people can really know how best to reach out to people in the sites, and also how best to just let them know that the government is doing something. And also at your personal level, you can also do something. Keep constant communication. Do not isolate yourself and make them feel unappreciated. You can give a call away, an email can do, a WhatsApp, whatever it is. Just make sure that they know that you're out there for them and you're doing something to make sure that they're good. Over to you, Ruth.
Thank you so much. Emmy?
Oh, I can
yes,
also
Emmy?
speak for those infected. I was infected sometime last month. And it is a scary thing when you're infected, because you really don't know how it's going to go. You don't know whether you're going to be one of those who's going to end up in ICU, or whether you're going to be one of those who recover fully, or if you're going to have your symptoms for a prolonged time. But what did help in my case was people checking up on you, like people calling morning, evening, and just checking, are you okay? How are you doing? And things like that. And also, I had a friend who could drop off my supplies that I would need for the week, because you need to self-isolate for 7 days, and it's not easy just being within a room and closing yourself in a room for 7 days. Nothing, you can't get out, you can't breathe in fresh air, well, at least like walking and everything. So it is a bit stressful. So if you have somebody who's infected, please try and just call and just check on them to see if they're okay. And then other cases, if you're able to help them do small shopping like groceries and taking to them, even if they can repay you, but at least you be able to do that for them so that they don't run out of food, it can be helpful.
Okay. Thank you so much, Amy, for that beautiful addition. Anybody else, because of time, anybody else who has anything to add on our today's topic about mental health, caring for the people who have been affected and infected in one way or another? Anybody who has something to add before we wind up because of time? Yes, ma'am. Maureen, okay, thank you.
Yeah,
Yes.
I'm about to talk about social support. It's really important during this time because it acts as a buffer to reduce stress. So it's very, very important to reach out to people and not just be isolated. Like we said, you can use WhatsApp, you can use any means that you can communicate so that you're less stressed and you're more in control of your life. Because the control that you've lost, you have to get it back. You cannot be, you can't leave it the way it is. You have to slowly get the control back so that we are productive. And trying to adjust to the challenges. Life has challenges for all of us, so we have to learn to adjust. That's the parting shot.
Yeah, thank you so much, Mom, for that parting share. Wanjiku Mai, I don't know if you can hear us, if you can add something. Okay, Amy, just a punching shot.
I just in this time, it's a really trying time. I just want to just emphasize what we've all been talking about, just being there for each other in the trying times, and we will get through it fine.
Okay, thank you so much. George?
Yeah, it's important that we reach out, as we have said, because not everyone is okay. It's a very unique time, and yeah, supporting each other at this time is really very important. I have lost a friend. We don't know what happened because I think we were out of touch. She just committed suicide on a day when we didn't know that she would. So yeah, reach out, even if you've never called someone and still they were in your circle. Just reach out to them. It's important at this time. That's, I think, what I would say.
Okay. Thank you so much, George. Let us try to reach out to our friends, our families, even our enemies at this time they need it most. Richard, you have any punching shot, kindly?
Okay, thank you very much. And, I would like to say,
Richard, you can hear me?
Yes, I can hear you.
Okay.
Are you getting me from the other side?
Yes, go on.
Okay, thank you very much. So I was saying that we need to put on a lot of emphasis on checking our friends, our relatives, and our families, because it is a season that is a bit of confusion. So we have to put on more energy. Don't just stay for 2-3 days without talking to someone. Take some hours, even if it is only saying hi, even through an SMS or something like that. I think that is the best way we can be able to link to them, and also we can be able to understand whether they have any problem that they require any assistance. Thank you very much.
Okay, thank you so much, Richard, for that contribution. Wanjiku Mwai, are you able to get me faintly?
Yes, I am.
Yes. Kindly give us your punching shot.
I think we should have more of these forums, especially at such abnormal times. And just like it's George who said, it's good to check up on people. Don't be the friend who waits to be called. Call. Check up, text people, talk to people, ask them how they're doing. And at least let's with checking up, we shall try minimize mental disturbance, and let's maintain. So it was an insightful meeting. Thank you.
Thank you so much, Wanjiku. You're welcome. We shall be having many of this meeting arranged starting from next week, and we could wish to welcome you once again, Wanjiku, to participate, and even tell your friends so that they can also be able to participate. So we all of us need to learn so that we can understand how we're going to cope up with this pandemic and come out successfully, all of us. And Flynn, what is your parting shot, kindly?
See you next week. It will be grand and more interesting. We can't wait for next week, sincerely. It will be fun.
All right.
See you all. Don't miss.
Okay, see you.
Thank you so much. I want to thank all of us for making part to be part of this today's meeting. I understand that without this, there are many people out there suffering. There are many people who cannot be able to speak out. And that's why we've taken this initiative to make sure that we're reaching out to many people who are not able to speak out. And we want to be a voice unto them, and not only a voice to listen to, but to help. And I want us to take it as a social responsibility to help one person. Starting today, kindly take a phone, call someone, text someone, reach out to someone, so that you know how they're faring on. Then together we fight this, and I know we're going to come out successfully. I want to thank Aflin for convening this meeting. Starting from next week, we'll be having many of these meetings coming up, be having different topics to be discussed. And in case you have something or maybe a topic that you wanted to be covered, kindly don't hesitate to write to us. Kindly, you can reach on Aflin Tafi and express your views, your comments, and any concern that you have, so that we can reach out to as many people and make it a success. Thank you so much, and may God bless all of us, and may you have a good night.
Same to you.
Bye.
Bye.
Bye. See you.
Bye.
Thank you, Richard from Somalia.
See you next week.
Thank you, George. Thank you, Marina. Thank you,
Thank
Amy.
you. Yeah.
See you
Yeah.
next
Bye,
week.
everyone.
Thank you.
All right. Good night.
Good night.